Hey guys, my name is Natalie Hanline and I am a public health educator here at the Davidson County Health Department. Today I want to talk about the importance of vaccinations and why it's important for our older adults to get vaccinated and what vaccines we should be thinking about as we get older. So I know we hear a lot about vaccinations throughout our life. We hear about it as we're young, and then as we get older, we also hear about these vaccines that we need to get as well. So what is a vaccine? Vaccines contain the same germs that cause the disease. The germs have either been killed or weakened to the point where they do not get you sick. A vaccine stimulates your immune system to produce antibodies. So this would be exactly like if you were exposed to someone who was sick or currently carrying the disease. And then after being vaccinated, you develop immunity to that disease. So without ever having to catch it or get sick, that's how you get immunity. And vaccines prevent diseases. So 3 important reasons for older adults to get vaccinated would be that you may be at risk for serious diseases that are still common in the United States today. You can't afford to risk getting sick. And you can protect your health as well as the health of those around you. So family members, friends, those sweet grandchildren or great-grandchildren, you can protect all of those you love by getting the recommended vaccinations for yourself. So one of the biggest vaccinations that we're going to talk about today will be the flu vaccine. And I know that it's really important every year, and we typically hear a lot about it. But this year we're gonna stress the flu vaccination, and the reason why is because we all know that we're experiencing COVID-19. And we really don't want anyone to experience getting COVID-19 and the flu at the same time. So it is going to be really important that everyone is up to date on that flu vaccination this year. Vaccination is really important for those who are high risk of serious complications from flu, and typically people who are high risk would be considered adults 65 years and older, those with serious diseases such as HIV and AIDS, heart disease, kidney and liver disease, lung disease, blood disorders, those with asthma or cancer and diabetes, pregnant women, and young children. So like I mentioned, those sweet grandchildren or great-grandchildren if you have any. And what is the flu vaccination for? The flu vaccination causes antibodies to develop in the body about 2 weeks after you're vaccinated, and those antibodies provide protection against infection with the viruses that are used to make the vaccine. So a little bit about the flu continued will be healthy habits to prevent the flu. So especially this year, like we talked about a little bit earlier, we are experiencing COVID-19, so we want to avoid close contact, stay at home when you're sick, cover your mouth and nose when coughing or sneezing. We want to wash our hands often and avoid touching our eyes, nose, and mouth. And we want to make sure we're practicing other good health habits. A big question we get often is, where can I get a flu vaccine? And you'll be able to get your flu vaccine at your doctor's office, clinics, health departments, pharmacies, most employers, and schools. The next vaccine that I'm going to talk about is the tetanus vaccine, and this vaccine is typically known as Tdap, so you might have heard your doctor refer to it as that. The disease itself is also known as lockjaw, and it is a serious disease that will cause painful tightening of the muscles that is typically all over the body. And it can lead to locking of the jaw, so that's where the lockjaw name comes from, so that you cannot open your mouth or swallow. And tetanus leads to death in about 1 in 10 cases. So who should get vaccinated for tetanus? Any adults who never received at least 3 doses of the diphtheria-containing vaccine should at least receive 1 vaccine, and then adults should receive a booster dose every 10 years. The vaccine itself is to prevent tetanus, and it's generally given in combination with vaccines that also prevent diphtheria and pertussis, which is also known as whooping cough. The next vaccination that I want to talk about is the zoster vaccine, which is also known as shingles. Some of you may be familiar with shingles and know what it is, but some of you may not. Shingles is a painful skin rash that often comes with blisters, and it's caused by the varicella zoster virus. This is the same virus that causes chickenpox. And anyone who has had chickenpox before can develop shingles, and the reason for this is because the virus actually remains in the nerve cells of the body after the chickenpox infection clears, and the virus can appear years later causing shingles. And who should get vaccinated for this would be all adults 60 years and older. And the vaccine itself is recommended to reduce the risk of shingles and its associated pain in people 60 years and older. The next vaccine that I want to talk about is the pneumococcal vaccine, which is known as PCV13 and PPSV23. And this disease is caused by a type of bacteria. Some people may get ear infections and sinus infections, and then some people may never actually get sick or have any symptoms, but they are carriers, so they can infect others even though they don't get sick or have any of those symptoms. And this can lead to different types of health problems, including serious infections in the lungs, the lining of the brain and spinal cord, and the blood, so known as pneumonia, meningitis, or bacteremia. And the vaccine itself, there are two different types of vaccines like I mentioned earlier, and there is the PCV13, and this is for all children younger than 2 years old and people aged 2 years and older with certain health conditions. And older adults may discuss and decide with their health provider to receive the PCV13. And then there is the PPSV23, that is for older adults, people aged 2 and older with certain health conditions, and adults who smoke cigarettes. And then a little bit about this continued would be who should get vaccinated. So all adults 65 years and older should get vaccinated, but it will just depend on what vaccination you had prior or which vaccination your doctor thinks is best for you. And adults 64 years and younger should get vaccinated that have conditions such as immunocompromising conditions, functional or anatomic asplenia, cerebrospinal fluid leak, and cochlear implants. It is important to always remember that you can still get sick even with your vaccinations. Some people believe that as long as they're getting their vaccinations and they're doing everything right, that they will not get sick. And unfortunately, that is not the case. It is still possible that you can get sick even with your vaccinations. And it's also important that you always speak with your doctor about getting the vaccines that are right for you. And this last slide is just a slide of my references, so it shows where most of my information from this PowerPoint came from. Again, if you guys have any questions, please feel free to reach out to me at the health department. I'll be glad to help any of you guys if you need it. Thank you.